In this video, I want to talk to you about using dental implants if you have a top denture. So traditionally, people with a top denture, it looks somewhat like this. So it's got teeth on it, it's got a full palate. Okay, when the denture was first made, it usually sits pretty good, and most people have a fair amount of success. They put it in, they swallow, it has some suction. That's why it's extended so far back, and it grips in the top mouth really good. However, over time, people find their denture gets loose. Now, what dentists haven't done a great job of explaining to people is the denture itself doesn't change. This hard acrylic stays the same. What happens though is the bone underneath the denture, the bone that the denture sits on, starts to shrink over time. And as this shrinks, the denture gets less and less retentive, gets more and more loose, and we keep making new dentures, or we get the polydent and all the adhesives, and we're trying all these alternatives, and then we start to realize that this denture just isn't going to fit very good. So people turn and say, what can I do now if my top denture isn't functioning the way it used to, or it never functioned well from the beginning? Well, that's where the beauty of dental implants shines through. So when you have a top denture and you're looking for alternatives, there's a couple things we can do. If you have a lot of bone in your top jaw, then we can place implants in your top jaw. Generally at least 4, and they have to be parallel, which is why you need a lot of bone. I'm going to explain that in other videos. Up to, if you can place 6, then what we can do is we can use your top denture. I'll show you an example. We can put holes in the denture in these little snap-ins. So you place implants into your top, so the implants would go into the top jaw. There'd be little bits of metal sticking out. We'd have holes in the denture, and the denture would then snap into the implants, and it gets very difficult to take out. So on the top, you can do that with 2 or 4 implants, and it'll snap in and give it more retention. However, if you use 6 implants at top, you can then cut off the palate and do what's called a palateless denture, because the palate bothers a lot of people. It's very hard to eat sometimes. You don't taste your food. You don't have temperature. So without the palate, there is an increased pleasure in eating. However, you would need 6 parallel implants on the top to allow the top to engage and cut off the palate. So that's one option for using implants to support your top denture, and it's a great option, and it really helps a lot. However, there is another option. Now, this is removable and comes off and on whether or not you have no implants or the gauges into implants. The other option you have is something called fixed. It's called all-on-4. It's called a hybrid. It has many different names. But basically, it's your top denture, and what we do, we cut off the palate, we punch holes in it, and we screw it into implants. Now, for this option, believe it or not, it's called all-on-4 because all you need are just 1, 2, 3, 4 implants. So I use the top denture, and this is a top denture. We've cut away the palate, punched holes in it, and we've screwed it into the implants. It does not come off and on. This is screwed in, it's set in, and it is not coming off. So this is another way you can use dental implants to help improve improve your experience of a top denture if you have a top denture. So in this video, I explained to you 2 different ways to use dental implants to support your top denture to provide you with a better top denture experience.